All right, and we are live. Super exciting today. Well, let's wait for some people to start joining in. I know we have a fair amount of people that registered for this one, so we're just gonna hang tight here. Or waiting, Dr. Nard, how was your day? I think today
It,
wasn't a clinical day for you. You were
it
off,
was
right?
good. Yeah, no, it was not a clinical day for me. I got some chart notes done and some other administrative stuff. So, it's if you're listening to this in the future, it's like 4 degrees outside. So it wasn't a day to like go take a walk or something. So it's been an inside day.
Yeah.
Um,
Hey, why?
yeah.
That's actually a really good topic because you're hearing like all the biohacking podcasts
Yeah.
and just in like the importance of getting morning sunlight, right? And we also
Yeah.
talk a lot about seasonal depression disorder, which is probably something we're going to talk about today's episode because we are talking about the mind body connection.
Yeah.
How do you get, and also grounding too, right? I mean, like the ideal is like
Yeah.
you get morning sunlight and you get some morning grounding.
Yeah,
Um,
it's really hard. Because the Northeast and most of the country actually in Florida today, because if you're listening in the future, it's the end of January 2026, and we've been in a cold front all across the country, especially on the East Coast for days, and it's like 4 degrees or something right now where I am, and probably where you are too, Cole. So it is really hard to acclimate the body to nature in the really cold weather. So I mean, you can get sunlight, but you gotta put a coat on, if you want to get out in the morning and take a walk around your neighborhood for 10 minutes, you'll still get benefit of being outside. But it is really cold. So,
mhm.
but it is something that it can be important even though it is cold. But definitely it's a big issue with our patients. They struggle with seasonal depression because
Mhm.
the cold and the darkness, but it is definitely getting lighter, thankfully. It's not
Yeah,
dark at 4 o'clock.
I know. Yeah, I noticed that the other
I
day.
noticed that the other day. Yeah. So thankfully it's a little better.
Yeah, cool. Well, all right. Let's. People should start joining in shortly. So let's just get going here. So,
Yeah.
this is your first time listening. Uh, this is not medical advice. This is for educational purposes only. The idea of today's episode is really going to be talking a lot about the mind body connection, which is something that's conventional medicine oftentimes overlooked.
Yeah.
So yeah, let's get right into it. So, Dr. Nard, why don't you give a quick intro, kind of on like your background, how you got into functional medicine, all your licenses, and then we'll get right into the kind of meat of this episode.
Sure. Yeah. I'm one of the full-time providers at MedMatrix. I have a background in chiropractic medicine and natural medicine, nutrition. I also practice medicine as a PA. And I've been practicing functional medicine for going on 10 years now. I got into functional medicine really as a reflection of how I live my own life. I'm into bodybuilding. I'm going to be competing in my first bodybuilding competition later this year. I love nutrition and lifestyle. From like a clinical perspective and how people can improve their longevity. So functional medicine is just really the way I've always had a philosophy of healthcare for myself. So it's really a passion project. So it's really easy to help people as a provider do it for others.
Yeah,
So yeah,
fantastic.
yeah. It's not
All right,
work when you enjoy it for yourself,
yeah,
as they
hundred
say.
percent.
Yeah.
Yeah, yeah. All right, well, we got about 20 people in here, so let's get right into the episode. So, yeah, what is the mind body connection? Right, you hear the term thrown all around, but like actually, what is it really?
So the mind body connection is really it's a very intricate and anatomical system and network, but for layman's terms, it's really what the influence of the mind and how you think and how you process and what you're dealing with emotionally, physiologically in your mind, and how you're thinking and stress and all those things, and how it reflects physically on the body. So the mind body connection is something that was not really well talked about for a long time in like a healthcare approach, but it really has become much more prevalent in recent years. And I think COVID really brought it to life because COVID really changed the way we interact, and we were very isolated, and it made us all very different physically and how we dealt with stress and how we dealt with our physical ailments. So there's definitely this shift in the world of understanding how the way we think and how our stress and our emotions impact our physical body. And it's a two-way street too. So it's not just the mind on the body, but it's the body on the mind too. So it's a huge piece of what we do in functional medicine. And one of the things we want to talk about today too is how it influences people with complex illness or chronic health issues and trauma. So really, really important part of everybody's health, but under recognized in mainstream medicine for sure.
Okay. Gotcha.
Yeah.
So, what like when you say mind body connection, trauma on the body, like
Yeah.
what's actually going on like a physiological level that is causing that?
Yeah. So a lot of people experience trauma in their life, and you could understand it in different ways. And I talk about trauma a lot with my patients because a lot of people are going through something that is a trauma, but they don't really understand that it's a trauma. It could be a divorce, it could be a problem with a family member, you know, a spouse, a child. It could be stress at work, it could be financial, it could be um, some sort of car accident, which is like a physical trauma, right? There was an injury, there was broken bones, a hospitalization. There's also things like sexual trauma or emotional abuse by a spouse or a family member or a parent or a child or something. And all of these situations play a huge role in how we process um, our hormones and our stress response. And it really is not trauma and the mind body connection. It's not a it's not a psychological experience. It's really a physiological imprint. So,
But how does that work? Like how does
yeah.
like
So,
stress
what that
impact
means is,
hormones?
yeah, it's like a when you experience something traumatic, your nervous system goes into overdrive. So, some sort of stressor or traumatic event really triggers what we call your autonomic nervous response in your sympathetic nervous system. So, the autonomic nervous system is the nervous system that you cannot control, right? Your breathing, your heart rate. Um, and when you go into this fight or flight, it starts to change the physiology of the body. You get chronically elevated adrenaline, you get chronically elevated norepinephrine. These are the fight or flight chemicals, right? The chemicals that you need to like fight off a bear, right? When we talk about evolution and we were walking around in caves, we had to have this part of our nervous system to keep us alerted to outside triggers. So what happens is people get increased heart rates, their blood pressure goes up, they're tense all the time. And what happens is their digestion can get suppressed, their immune system gets suppressed, their reproductive function can suppress. So all of these physiological changes over a long period of time can lead to anxiety, irritability, insomnia, brain fog, low motivation. And then things like chronic pain start to happen. Um, Chronic GI symptoms, immune suppression, people getting sick a lot. So the physiology is really, really complex, but it's something that is happening to a lot of people that they don't understand,
Hmm.
and because they don't quite understand what things in their life are doing to them. Like I said, whether it's a stressful job or a divorce or a traumatic event, whether it was a car accident or a sexual trauma or something. So there are a
Okay.
lot of people struggling with this.
So I guess before we get into kind of like solutions, root causes, like kind of the
Yeah.
conventional versus a functional approach of the mind body connection and all that, I guess when is like stress actually a bad thing? Because stress is good to some extent. Like, like I have a
Yeah.
deadline at work. Okay, that's pretty normal. Or like working
Yeah.
out, like that's a stress. Like when does stress go from like totally fine to like this is actually impacting your health?
Well, what happens is long-term stressors, and in this instance, when we're talking about specifically trauma, right? This is going beyond the threshold of say a normal everyday stressor. Humans are supposed to be stressed. Humans thrive in stress, and we do well at minor stresses to keep us motivated and keep us sort of moving forward. But we're talking about things that are really, really traumatic beyond the threshold of say a normal stress level. So what happens is this constant stress or this really heightened stress that's pathologic will start to alter the brain chemistry. There's something called neuroplasticity. If you've ever heard of that, Cole, before,
I've
neuroplasticity
heard of it, but
is
why don't you define it
yeah,
for
neuroplasticity
yeah.
is changing the way the brain is wired. So you're wired a certain way to behave and do certain things based on your genetics and your upbringing and nature. But experiences you've had can really change the way you think and change the way your brain is wired. So when you experience chronic stressors or a really, really significant traumatic event, what happens is through neuroplasticity, the brain circuitry starts to rewire. And you become this person that has a very heightened threat perception, right? And like every little thing becomes a big thing, right? I call these people like it's almost like you're a nerve ending. It's like
Mhm.
everything is you're just so tense, every little thing kind of jolts you. And that's when it becomes a problem. So parts of your brain become overactive or hyperresponsive. Other parts of the brain that are calming start to shrink, and
Mhm.
then you can have impaired memory, impaired focus. You're not as sharp. You're not as emotionally regulated. You don't have as much good reasoning ability. Um, so all these things can present in a very complex manner for a patient, but they don't often it's very often misunderstood where this came from. Um, and when you think about like a physical symptom, right, let's say chronic GI problems, right? You go to your GI doctor, 9 times out of 10, or probably more than that, actually, probably almost 100% of the time, the GI doctor is probably not going to sit you down and say, let's talk about your childhood trauma.
Mhm.
Or have you ever
Right.
been a victim of sexual abuse or violence? Or,
Mhm.
what's your stress level like? What's your home life like? So, people that struggle with physical and physiological and emotional symptoms secondary to stress and trauma could go years underappreciated for what they're experiencing, and that's the sad part.
So
So
how is like something like chronic stress connected to your GI and like something like constipation? Like how are those two things?
yeah,
Yeah.
so for the gut specifically, there's something called the vagus nerve. So the vagus nerve is one of the biggest nerves in the body that controls part of your autonomic function. So when you're in this, what we call sympathetic dominance, which is this fight or flight response, it impairs gut function because it can reduce things like stomach acid. It can reduce digestion ability, like having less bile or less digestive enzymes, because the nerves from the vagus nerve are innervating the gut. So if this part of the nervous system is dysfunctional, the gut specifically is going to start to be dysfunctional. So you can start to get altered motility, right? Your gut digestion is not something you control, right?
Mhm.
That's part of your autonomic nervous system. You don't consciously digest food. So
Mhm.
if this part of your nervous system is misfiring or is hyperactive, it can cause the actual gut function to stop working as well, hence being constipated, or the flip side, having diarrhea, or the microbiome starts to shift and you get more inflammatory gut bacteria, which can lead to chronic GI symptoms. Um, it can go the same way with like sexual trauma, where people have issues with their pelvic floor, libido, orgasm, arousal, because the nervous system that's innervating those specific tissues is becoming dysfunctional. So, anytime there's nervous system dysfunction, whatever tissue it's innervating can start to become a problem.
That's
And
really interesting.
that's really the baseline of this connection is the nervous system is dysfunctional and the tissue it's responsible for innervating becomes dysfunctional.
So would that be like a good example of like a root cause of
Yeah.
like something like we like that term root cause is thrown a lot, but I think it's kind of
Yep.
vague. It's overused. Okay. So
That's the
what so
yeah, that is the definition. That's the root cause definition
so what
of
happens when like
this.
patients come in who let's say are having GI issues
Hmm.
and they're just getting, like Miralax or a laxative, or they're having some type of anxiety and they're just getting anti-anxiety medication. And it's
Right.
something that you said was related to the vagus nerve or
Yeah.
neuroplasticity or like, trauma. Like what happens when you cover things like that up, I guess.
When you're not addressing it, you mean? When you're not
Yeah, like what?
addressing
Like
the
I imagine you see this all the time, right?
Yeah, yeah. So as I mentioned before, a lot of these patients that have this like have trauma as a central root cause of their problems can be underappreciated by their medical providers or other healthcare providers for a long time. And a lot of these patients that struggle with trauma as a physical manifestation of their health concerns are sort of scooted around from specialist to specialist because they might have a lot of different symptoms. And a lot of times they end up on psychiatric medications or anti-anxiety medications, or they're disbelieved, get a lot of gaslighting. It's all in your head. Um, so understanding this as a potential root cause of someone's concerns is really can be very beneficial, because if it is, then you're opening a door to really understanding how to fix them.
Okay.
That's really the important part. Yeah.
All right. So I'm gonna play devil's advocate here.
Yeah, of
I'm gonna
course.
put some pressure on you. So
Yeah,
like
no, go
what
for
so
it.
like as a functional medicine provider, like what are you gonna do? Because like you're not a therapist. Like
No.
how are you gonna help
Yeah.
this patient? Is it yeah, walk me through that.
I say that all the time. It's like I'm not I therapize a lot of my patients and I'm not a
Okay.
therapist. I make that very clear. But a lot of people need this type of work. They need to understand it. And that's the other thing that we can talk about separately, is that a lot of patients don't buy into this. My gut problem is because of my stress level or trauma, or no, I don't buy into that. And no, I'm going to go see someone else. Totally fine. Not trying to be right, not trying to convince you that, this is the right thing, but that happens a lot. So,
Okay.
um,
But what do
that's
you do?
kind of
Is like I guess like what are the tactical things that you do? Like is it just therapy? Is that it? Or are there like other
no, no, it's not necessarily therapy. It's first of all identifying if this is the root cause, and
okay.
that can take time and trial and error. But the answer really is healing the nervous system. And what does that mean?
Mhm.
Well, that could be therapy. It could be, we just talked about at the beginning of the podcast, right? Grounding and sunlight. And, if people are living and existing in an environment that is causing their body to be in a hyper stressful situation, how can you heal from that, right? If you're chronically stressed at a job or a financial situation or a relationship or a living situation, the number one rule is, well, you got to get out of that, because you can't allow your body to heal while it's in this chronically stressed state. So it can be very hard. It can be very hard to do. And this goes beyond medicine, right? Or like something clinical that I can give somebody. This isn't a supplement. This isn't a prescription. This is a lifestyle, often people's livelihood, you
Yeah.
know. I had a patient years ago that had very complex chronic illness, for many years, had been treated by various Lyme specialists and immune specialists, and she was thought to have mold illness and autoimmune, like the whole everything.
Mhm.
And I really struggled with her for a long time, and after a while, she started to open up to me, which it takes time to trust a new provider, and she finally told me. This was after a few months, but she finally told me that her chronic health symptoms started after she was raped. And it's like, oh, okay, there it is. So, but then what do I do about that as a right, as a functional medicine provider? It's really trying to then pull the pieces, pull the layers away. People need specialized trauma therapy. They need, like we said, more grounding. They need the ability to heal. They need nutrition. They need low stress environments. They need to optimize their cortisol. There's a lot of functional medicine tools that we can use, but trauma and the mind body connection goes far beyond a supplement plan or a
Mhm.
prescription.
Yeah.
So it can be very, very tricky. Yeah.
Can you talk about strategies that you used with this patient? Like how did you start to heal her mind body connection?
Well, figuring that out was very healing. So we
Mhm.
didn't do anything, right? But or I didn't do anything, but when she came to the realization that her nervous system had been in this hyperactive state because of unresolved traumatic experience, it started to put her perspective in a different way. So it allowed her to look at herself differently. And that is part of the healing journey, right? I'm not giving her anything. There's no supplement plan. Um, but it was a realization that, okay, I understand myself better, and this has to be part of my healing journey. It's almost like people who struggle with addiction or alcoholism in the 12-step program, right? It's a very similar kind of thing. You have to go through different stages of the healing journey to get to the end. It's not a
Mhm.
linear to the end.
Interesting.
So yeah, it's very complicated, and that's why we talk about it. It's extremely important for people to understand, but it is not easy.
Okay.
Yeah.
One thing that you said that is like a word that's thrown around all the time is cortisol. And you talked
Yes.
about how with this patient, like managing cortisol was vital.
Yeah.
How do you even do that? How do you, and I don't know if you have any examples, that'd be great.
A lot of times when we're dealing with trauma and stress hormone dysregulation, trauma disrupts the HPA axis. A lot of people have probably heard that term before. It stands for the hypothalamic pituitary adrenal axis. So it's different parts of your brain and your adrenals connected together. Your adrenals are small organs that sit on top of your kidneys. So cortisol, one of your primary stress hormones, is made in your adrenal glands. So when you go through early or acute trauma, it can cause chronically elevated cortisol. And um, what happens eventually is, so the body is in this heightened stress response. The stress hormones are just firing on all cylinders all the time. You're feeling it physically, you're feeling it emotionally. But then eventually, what happens is the body starts running out of gas, and long-standing trauma will often lead to cortisol blunting. So the cortisol becomes very, very chronically low. Cortisol is really important for regulating your circadian rhythm. And then there's downstream effects of that, right? You can get blood sugar instability, sleep disorders, your thyroid can be suppressed, your sex hormones are dysregulated, and you really become physically and emotionally burned out because there's just no gas left in the tank. And that's really the end game of someone that's gone through something like this. That's what we see a lot. I don't know how many patients just this week I explained this very phenomenon to them. Um, they're usually older, maybe 50 to 70, have had a extremely stressful period, 10, 20 years, stressful job, not sleeping, low hormone function, poor diet. They've just run the body ragged. The stress hormones are really, really high, and then they just bam, nothing left, no gas in the tank. People don't sleep anymore. They're barely functioning. They barely eat. They're experiencing very little joy, very little happiness, and it just becomes so chronic, and they don't know how to get out of it. So it's a huge part of what we deal with. So there is the medical piece, right? People are blood sugar, imbalanced, hormone imbalanced, but then is there something that led to that on top of it? It's a lot.
Okay.
Yeah,
Wow.
yeah,
Fascinating.
yeah,
What's
yeah.
just curious, patients' reactions when you kind of tell this to them normally, how is the reception?
The reception usually is, yeah, that's exactly how I feel. Is I don't have any gas left. But as I said earlier, I alluded to earlier, some patients, when it's very clearly obvious that they have some sort of sympathetic dysfunction, traumatic response, sympathetic overdrive, some people don't buy into it. It's like you're telling me that my gut issues are related to my stress or like my stressful life or my traumatic experiences. I don't know. There's a lot of new research that supports the idea that autoimmune disease is related to trauma. There's something called adverse childhood experience score. And it's a tally of 10 types of different childhood traumas. For example, abuse, neglect, household dysfunction. And it really measures a person's ability to have adversity. So people that have higher ACE scores, we call them ACE scores, have higher likelihood of chronic disease and substance abuse and depression in adulthood. And there's also this thought that things like autoimmune dysfunction is related to complex traumatic events because the body is in this constant fight or flight, and then the body just starts to recognize itself as foreign. So when you're trying to explain this to a patient and they're like, I don't feel good and I have autoimmune disease, but it's related to trauma I've had, it sounds, for some people, it sounds very wishy-washy, very woohoo. It's like it's a little too tree hugger for me. But the science is extremely, extremely supportive of this, and we see it every day. But it is sometimes really hard to educate patients enough where they understand the connection.
Gotcha. So just curious, like if the science is there, like why is this not talked about more in conventional medicine?
Because you can't give people a pill to treat it. People that have, say, autoimmune disease driven by childhood trauma or an abuse or something, there's no pill for that. So how do you integrate the mainstream conventional medical model of we give pills for people's ailments to this? This is not a pill problem. It often is treated that way, right? Patients with these issues are given antidepressants or anti-anxiety medication or other types of interventions to treat any given symptom they're having, right? A gut issue or a skin issue or whatever. But there's no pill to treat trauma. So who's doing that work in the mainstream medical system? There's lack of mental health providers too. A really skilled and empathetic healthcare provider might recognize this, but they don't have the tools. Like you said to me earlier, I'm not a therapist. No, I'm not. So if patients need that type of work, how do I help them? Do I have mental health providers that I know? Sure. How many of them are taking new patients? Not that many, right? Post-COVID, mental health is just skyrocketed. Everybody needs help. So it is not a straightforward answer. And that's why the medical community, I think, does a very poor job at this.
Okay.
Yeah.
Gotcha. And I guess why is that on like a deeper level? Because I think a lot of people are thinking, well, like doctors aren't bad people. Like a lot of great people I know are medical doctors who still work in conventional medicine.
Yep.
So it's not really the doctors per se, but more of a system issue. That's what you're saying.
Yeah. Yeah. And I've said this on the podcast many times. I strongly believe that my colleagues in healthcare, especially in conventional or sort of Western driven medicine, are not outwardly bad people or they don't want to help people, but they are at the mercy of a much bigger machine of commercially driven, financially driven medicine and healthcare driven by big companies and insurance providers. So it is really, really tough to get people the appropriate care that they need in that type of a system. Yeah. So you can recognize it, but it doesn't create an automatic solution. But as I was saying earlier with the patient example that I had, if a patient can come to a provider and better understand themselves, better understand what maybe tools they need to try to start working on, that is very healing. There's a very, very quantifiable healing benefit to that. And just to say, just to have a patient feel heard or understood or better equipped at understanding where they've come from with some of these issues, it is a huge part of their journey and it can be very therapeutic.
Gotcha. Yeah. Okay. Wow, we've covered a lot, guys. So we got about 100 people in that here since we started. If you're enjoying, if you're enjoying this so far, comment like Michelle did, and let us know we're doing a good job.
Take some questions if people have questions.
We like to answer questions for people who take time to join us live. So answer questions.
We can't give medical advice, but we're happy to answer questions if we can.
Exactly. And then, if you are listening or interested in becoming a patient, if you have our number, just call or text us. Or if you're new, just go to medmatrixusa.com and you can actually apply as a patient right on the website. So let's talk about solutions here. So you talk
Yeah.
about how like there's not a pill for trauma and kind of like fixing the mind body connection, but there are strategies, right? A lot of that is lifestyle too. But is there any like holistic remedies, tools, things like peptide supplements, like more just more holistic treatments that can help patients get better faster?
Yeah, I mean, the thing with the functional medicine approach is really to, and we've talked about this so many times on our podcast with different types of conditions, um, whether it's complex chronic illness or hormone dysfunction or gut, whatever. It really is taking the patient for who they are at that given time, right? It's taking them at face value and saying, okay, this is what we have to work with. This is dysfunction that we see. How do we do our best? And sometimes that is the best place to start, because in most of what the patient is getting from the conventional medical setting is just a lot of medication to kind of heal symptoms, which is not necessarily a bad thing if there can be some effectiveness to that. But what we can start doing with patients is giving them the tools that they are needing, that is really driving them to be in this bad place. A lot of
Mm,
my patients, they're not eating well. Okay, well, let's start there, right? If nutrition is poor, you're not feeding the body what it needs, how can it be optimal, right? We don't water our plants with soda. We don't, we don't feed our animals like crap food. So let's start with good sustenance, right? If there's nutritional deficiencies, are people getting enough vitamin D? Are they, we talked about this at the beginning. Are they um, harnessing the powers of, grounding and meditation, or practices of gratitude, or taking a walk, or sunlight, things like that. So there are very simple ways we can start to just feed the body with the energetics that it needs. And I'm not necessarily talking about energetic medicine, that's a whole different thing, but really giving what the body needs to function, right? We need proper nutrition. How can we improve sleep? Can we use certain supplementation to improve sleep? Can we use certain supplementation to improve the stress response? Can we talk about journaling? Can we talk about meditation? Can we talk about ways to improve some of your meals that you're eating each day if your diet is poor? Can we talk about ways to have better self-care, right? A lot of people that struggle with traumatic experience and health, they are very outward people. They don't take care of themselves. It's not in their nature. So there are very simple things that we can start to do. And then, as I said, a lot of times it's really understanding the nervous system, rebuilding that foundation, getting them out of the sympathetic overdrive, getting them in a rhythm, talking about their routine each day. And yeah, I do have a lot of times my appointments turn into a therapy session. Not a therapist, but hey, if my patient needs to sit and talk to me for a half an hour, and it helps them just feel a little lighter, that's healing, right? There's nothing
mm,
wrong with that. We haven't done anything. I haven't given them any medication, but if they needed an outlet to kind of vent or gather their thoughts, or some way to make their day feel a little better, that's part of the journey too. So
mm.
it's all these little things that start to add up over time, and that's really our goal from a functional perspective. Yeah.
Okay, yeah, fair enough.
Yeah.
So, um, are there any advanced tests that are available that can help us actually uncover, like, get data around the mind body connection, see if stress is playing a role in health? I know there's adrenal testing, cortisol
Yeah.
testing. Like what are some of the testing options to help us get a better grasp on this sort of thing?
Yeah, I mean, there's no test that's going to tell us if you have poor mind-body connection. There isn't like a test for that, but we're testing around it, right? As you mentioned, the hormones, we can check people's cortisol. We can look at their hormone function. We can look at nutrition optimization, thyroid function. We can sort of get a picture of the dysfunction, but there is no actual test to say, oh, look, trauma. We did a test for it. There it is. It doesn't exist.
Okay,
So
gotcha.
really,
But what
what we're
about cortisol? Let's talk about cortisol testing because
yeah,
cortisol is like infamous, like it's a stress hormone, right?
yep,
Cortisol is released when you're stressed.
yep.
So what can we get away from a cortisol test?
Cortisol tests are really great at understanding how people's cortisol and their stress response changes during the day. So these are usually advanced tests done using a patient's saliva. So cortisol changes throughout the day. Your cortisol will spike in the morning, and that is how you open your eyes. When you open your eyes for the first time, that is a spike in cortisol. Cortisol peaks around 11, 12 in the afternoon, late morning, early afternoon, and then it starts to go down gradually throughout the day, and then it drops below a certain threshold for you to then fall back to sleep again. And then it stays low overnight so you can be sleeping, and then again does the same thing, peaks. And so what we can do is we can do some advanced saliva testing to map out this graph to see where your cortisol is at any given time of the day. Can be really, really beneficial to understand if people are having symptoms related to high or low cortisol at different parts of the day, because that can really tailor the way we treat someone. So it is a really, really helpful thing. And then you can pair cortisol with like your sex hormones, right?
Mhm.
How does cortisol pairing that? Or especially with women, how is cortisol affecting their menstrual cycle or their time of the month symptoms related to cycle? Very, very helpful testing that we can do. We do all the time, every day.
Yeah, totally. So
Yeah.
I'm ready. So here's my this is actually mine. Got this right
Yeah.
from my chart. Cortisol test.
Yeah.
Um, so explain what's going on here.
Yeah. So the green like shaded area is sort of like the reference range of high and low. So you see the line on the bottom, the red line on the bottom is like the low end of normal, and the red line on the top is the sort of um, the reference range sort of at the high end. The solid green line is the very, very optimal, like that's where you want it to be.
Okay.
So the green line is right where you want to be. So for you, there's nothing at waking, but you sort of follow the normal path, and then you peak, and then it comes back down, and then you had a little bit of an outlier towards the end of the day, but you are following a fairly normal pattern of cortisol. So that's good. That's what we're expecting to see.
Okay. So what
Yeah.
happens? Because like people talk a lot about high cortisol, but what about low cortisol? Like what happens if your cortisol like doesn't like? I know a lot of patients come to us because they have a hard time getting out of bed in the morning.
Yeah. Yeah.
Like
Yeah.
is that a result of low like your cortisol is down here?
Yeah, that's really low cortisol. And like I said, when we relate that back to like a trauma response or the mind body connection, a lot of times what's happening is at the beginning stages of some sort of a stress, you're getting high cortisol, but then after a while, the cortisol just is done. There's nothing left. The adrenals are so fatigued that they're not producing any more cortisol, and you're getting this failure to thrive kind of situation where you can't get out of bed, like you said. These are people that have 5 alarms, right, to get out of bed. Humans should really be able to get up. We evolved like when the sun comes up, you should be able to get up and get going. You don't we shouldn't need 5 cups of coffee to get going. But people that are severely adrenal fatigued, have very low cortisol, these are the ones that are snoozing 5 times. They've got to get like a pot of coffee in them before they even leave the house. When they get to work, they've got another coffee. They're kind of falling asleep at their desk at 11 o'clock. They eat lunch, probably a very, very poor lunch choice, right? Something processed, something really carb heavy. They spike their blood sugar. Then they are totally asleep at their desk at 2, 3 o'clock in the afternoon because their blood sugar spiked. They have no cortisol to regulate it. They manage to get through the rest of their workday somehow. They have no energy to do anything else after work. They go right home. They get on the couch. They're in bed at 7, and they just repeat their day.
A lot
So
of detail. It's like you almost see like
this
patients
is.
like that
I
often.
saw 2 of them yesterday.
Wow.
Yes.
So how do you help
Yes.
that type of patient? Like how do we get their cortisol and adrenals back on track?
Yeah, you really have to start giving them healing. Healing, like I said, this sort of energetic, not energy medicine, but you got to feed the body, you got to fuel the body. So we've got to start giving people the nutrition they need. We've got to start working on how they handle stress, right? And how they're handling stress in their stressful life. We've got to try to regulate their hormone function. You know, these are often people, especially women, that are peri or postmenopausal, or they have no sex hormones. So there's even less gas in the tank. Guys with low testosterone, you know, there's even less gas in the tank. So what we have to start to do from like a holistic or functional approach is give them back what they're missing, because
Mhm.
that's really the key. So they're overstressed, overworked for a long time, and under serving and under fueling themselves. And that's
Mhm.
really the long and short of it.
Okay, gotcha. So what would this
Yeah.
look like? So if I like, what would high cortisol look like here?
For like on this graph,
Yeah. So it's like my cortisol would be like high at the end of the
mhm,
day, or like
it,
low. Like
it
what happens?
it could really change in any way. So some people have low cortisol in the morning,
Mhm.
right? So this first part of the day where there's this spike in this green part, this could be very low. So these are people that are struggling to get going, you know, a pot of coffee, 2 pots of coffee kind of people in the morning. And then they're struggling throughout the day. And then they go home and it's 8, 9 o'clock at night and they're wired. They can't sleep, right? They maybe can fall asleep, but they wake up at 2 a.m. and they're up till like 4 a.m. because their just mind is racing. That could be an example of a high cortisol spike overnight. So it's keeping them up. And then that poor sleep is just making it worse, right? Okay, they've had 6 hours of interrupted sleep. Now they got to get up again. They've got to try to go to work. They've got to try to be productive. So you can have changes in cortisol in different ways. You
Mhm.
can have low in the morning, high at night. You can have high all day, low all day. It can really vary, but the changes in the cortisol pattern from this normal rhythm is really just an example of the body trying to regulate itself from acute stressors. So we can have changes in the cortisol pattern. That is the body trying to regulate itself, but eventually it will just burn out. You will just lose all of it. And that's what we see a lot.
Gotcha. Okay.
Yeah.
We had Abby leave a comment here. How do you test cortisol levels?
So cortisol testing is done various ways. We do baseline cortisol testing as part of our standard panel for all of our new patients at MedMatrix, which is great. We can get a really good understanding of cortisol from everybody. I hear all the time from my patients, I ask my doctor to check my cortisol and they won't. So we will. We do it at the very first visit. But also, we can test cortisol, as I was mentioning a few moments ago, throughout the entire day, where we might do an advanced salivary test where the patient collects saliva samples at different points of the day, and
Yep.
that will generate this graph. So when we do a blood draw, we are only getting a snapshot of the day. It's very helpful because we can sort of correlate that to the time of day the blood was drawn, right? If we draw blood at 10 a.m. when cortisol should be almost at its highest and it's very low, that gives us an idea of what we're dealing with. But salivary cortisol testing can give us this graph that you're referencing here, Cole, that you did. So it gives us a nice understanding of what your cortisol is doing throughout the whole day. So
Mhm.
we do a lot of cortisol testing at MedMatrix. It's a huge part of understanding a patient's baseline function from a physiological stressor perspective, and then how it relates back to other issues.
Okay. Great
Yeah.
explanation. Thank you. Another one here. Is there a danger for a chronic pain patient that experiences pain insomnia? So I imagine that means like can't sleep because of pain and cortisol consistency.
Say the question again? Is there a danger?
Is there a danger for a chronic pain patient that experiences
Yeah.
pain insomnia? So someone who's pain, they can't sleep, and
Yep.
cortisol consistency. I don't know if what cortisol consistency means, whether that's like they consistently have high cortisol. I don't, maybe you
Mhm.
know what that means.
I, I don't. I guess I'm sorry to the person that asked the question. I don't understand what they mean by is there a danger? So is there something how I'm interpreting it is it dangerous for or is like
I
something
guess maybe
bad
let's
going to
talk about this.
happen?
What happens when you can't sleep? You can't sleep because you're in pain,
Right.
but
So
then your
so
cortisol is also messed up. Like, what do you do? Like, you
well
get the
pain is an inflammatory issue. Pain is a response to some sort of inflammation. So if there's high inflammation, there can be high levels of cortisol. So What can happen, especially for patients with musculoskeletal or pain issues, is when we relate it back to what we were talking about as our focus today on today's podcast of trauma. Like, trauma can increase like muscle guarding, it can alter your posture, it can create a lot of chronic pain issues. But then when we relate it back to, say, cortisol, right? Cortisol, it can be dysregulated because of chronically elevated inflammatory issues such as pain. So, yeah, there definitely could be cortisol issues with someone that's experiencing significant pain, and especially nocturnal pain. Yeah, that's definitely a thing.
Hmm. Okay.
Yeah,
So what about, I know we have a select few clients who are like high performers, whether they're like, the CEO of a company or they own their own
right.
business, or maybe they're,
Yeah,
they're a mom and they got kids and they got a day job and they also want to
yeah,
stay in shape. Like,
yeah.
what about the overachievers? Like how does cortisol and all that play a role in their health?
Um, these are what we call the type A'ers of the world. So people that are type A often, and there's actually some studies to support this, that type A people may struggle with issues like this more from a increased risk of certain things like autoimmune disease or fibromyalgia or IBS or cardiometabolic disease, because their consistently elevated stress response is creating heightened inflammatory response. So and this kind of goes back to the pain question, their stress response all the time is leading to elevated inflammatory markers, we call them cytokines or inflammatory molecules. So this reduces your body's natural anti-inflammatory signaling. You have heightened immune reactivity. So this is a person that is on guard all the time, and then
Mhm.
that is how their body responds. It's on guard all the time.
So I guess how
So
do you maintain like health while being, a high performing business executive or a mom that
yeah,
has or a dad that has two kids, a full-time job and works out?
it's
Like how do
all
you
it's all about recognizing boundaries, right? We've talked a lot about that in sort of this post-COVID world of self-care, is boundaries, right? People are demanding boundaries at work, right? They're demanding work-life balance. They're demanding balance in their responsibilities with their kids or their families, or people don't want to work 5 days a week anymore. They want more balance in life. So self care is one of the best ways, or this sort of perceived notion of how I need to take care of myself is one of the best ways that overachievers, or I don't want to say overachievers, that sounds negative, but people that are high performers, whether it's an athlete or, like you said, Cole, like a CEO or like somebody that owns multiple businesses, a lot of stress.
Mhm.
It's really their it's really about mindfulness of self-care, and making sure that they are listening to their body and taking the time to give it what it needs from a self-care perspective. So you can't work 100 hours a week and expect to be healthy. That's not it. Those two don't go together. So if that's the way the person has to exist to live and run their company, it does not lead to long-term good health and longevity. It's just not the way we're built. So that's the best advice I can give, is understanding that self-care and boundaries are an important part of taking care of yourself. And if you want to be successful, right? Like I use this, and we talk about this in the clinic all the time, right? This is sort of a philosophy of Med Matrix as a business. You and I both know this, that if we as employees of this company, me as a healthcare provider, if I don't take care of myself, and if I'm not optimal to show up every day and take care of my patients, I'm not much help to people, right?
Mhm.
So we have this mindset already, but a lot of people don't have that mindset. They will work until they can't work anymore. So
Mhm.
yeah,
Okay. Yeah, no, I gotcha. I mean,
yeah,
I would agree with you. I think everyone here is pretty focused on their health as well as helping patients, which is pretty cool to
yeah. We
environment to work
have
in.
to. We have
Yeah.
to focus on ourselves, because then we can't show up for our patients and be the best we can be. If I have to see, 8 patients a day, all day, I have to have a certain amount of stamina for that. Mentally, physically, I've got to be like, my brain's got to be going.
Right.
So if I run myself out and I don't take care of myself, then I'm not going to be able to take care of those people that are depending on me each day.
Do you think that's a problem in conventional medicine where it's like
Yes.
you like I mean I one time saw a primary care doctor schedule and it was insane.
It's insane.
It was
Yeah.
like 20, 30 people in a day and it's like that every single day. Like
Every
I
single
can't
day.
the
Yeah.
like
Yeah. And you think about like trauma, people that work in trauma surgeons, trauma nurses, people that are working 8, 10 plus hour OR schedules. They don't eat. They can't even go to the bathroom. They don't have any water. It is really, it's not a system that puts the self-care model at the root, because there's so many people that need help.
Mhm.
So they are the, especially like healthcare workers in hospitals, like I said, or some other similar field. It's, if you're like a primary care provider in primary care, you are, the demand is so high for you to perform at such a high level, but we're just not built to do that long term. So it burns. We talk about healthcare provider burnout all the time.
Mhm.
And it is very real. There's a lot of healthcare providers, nurses, doctors, whatever you're licensed in to do, you quit. People leave healthcare because it's too much. So it's definitely a huge, huge concern for healthcare.
Gotcha.
Yeah.
Um let's see. So all right guys, we're coming to an end here. We're at 51 minutes. We only got probably 8 minutes left here. We're going to move into some Q&A. If you guys want to comment some
Yeah.
questions, we'd love to kind of interact with you guys. Leave a comment if you're enjoying this. And then if you are listening and you're not a patient, you want to potentially work with providers like Colin, Dr. Renaud here, you can text us, call us if you have our number, or just go to the website, MedMatrix USA, and actually apply right there. Okay, so
We'd love to have you.
we got a pretty specific question here. So Sambi, we're going to have to kind of make this more broad so we can answer it. We can't give
Okay.
medical advice.
No, it's okay. Yeah,
This
whatever
one's
the
very
question's about, the topic.
so sounds like this person was addicted to some pretty serious drugs about 6 years ago. She
Okay,
quit 6 years ago
great.
and
Congratulations.
she's working but can't focus.
Okay. So let's look at this from, say, a conventional perspective, right? A person goes to their doctor and says, I'm having trouble focusing. What say a psychiatrist or a primary care doctor might say is, okay, let's try you on some medication for attention. Adderall, one of the like ADHD kind of medications. Okay, fine. Is that wrong? No. It's a thing. Is it going to be outwardly helpful long term? Maybe, maybe not. Don't know. But from the perspective of someone that is a former addict or struggled with some sort of drug addiction or alcohol or whatever it is, you have to again look at the patient the same way of rebuilding, right? There's trauma in that. Drugs, alcohol are traumatic on the body physically. So we have to look at that the same way we look at anybody else, is how do we rebuild? What are we lacking? And how do we hone in on giving the patient the best nutrients and rebuilding their, refueling the gas tank? That's sort of the best way. Because why can't they focus, right? Is it because of potential long-term damage of drug use? Don't know. Is it because the brain is sort of rewired from drug use? Probably. So it's complicated from an addiction perspective. Addiction medicine is hard. But I would approach the patient the exact same way. Look at what they're lacking, optimization, start fueling, and then peel away the layers as we go.
Mm-hmm.
Yeah.
Okay. Yeah, a lot of it sounds like it as I host these podcasts is just about giving the body the things it needs, whether it's nutrients, hormones, balancing things, and then the body can do a lot of the healing on its own, right?
Yeah, I mean, that's how we're designed. The body is not designed. We didn't evolve to be dependent on synthetic pharmaceutical drugs. humans existed for a long time before medication. Now, I'm certainly not anti-medication. I prescribe medication every day. And we have saved a lot of lives with antibiotics and other types of medical intervention that we've come up with in modern day science. But the body and humans did exist and can exist without them. But it's making sure it's in an environment that is of optimum, like resilience and longevity, and giving the body what it needs to exist. Yeah.
Yeah, I think it's a good note to actually end it on. So yeah, if you're joining us live, we appreciate you. We love having you guys live with us. We are going live pretty much twice a week at this right now. From the feedback. If you are interested in becoming a patient, go again to medmatrixusa.com, and you can apply to be a patient there. With that said, Dr. Renaud, anything else you want to leave patients with today?
I think just circling back to how we got started on the conversation is really understanding that, you know, your mind and your body are not separate entities. How you treat yourself emotionally, how you treat yourself from your environment, the things you experience every day, your stressors, your emotions, your experiences, really can morph who you are and can really change who you are physically, mentally. So it's really important that we don't forget that.
Fantastic.
Yeah.
All right, everyone. Have a wonderful day. Colin, thanks for your time. Dr.
Yeah.
Renaud. Bye.
Thanks, Cole. Bye.